Good morning, teacher. This is Pablo Hipólito Guzman, and now I will start with the Unit 5 that called Medical Practitioners 1. Okay. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council's list, or registered in order to practice. A doctor who treats patients or opposite to who only does research is called a clinician. A doctor who provides primary care for patients is known as general practitioner or family doctors. GPC usually works in group practice. Large group practice were in buildings and called a hair center. No, in British English, the verb is spelled practice and the noun is spelled practices. Specialists. Specialists. Doctors, for example, pediatrician generally works in hospital. However, those who works outside the NHC providing private healthcare may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branches of the medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, physicians, respectively. In Britain, male surgeons are addressed as Mr. and female as Miss. So Dr. Smith is physician and Miss is a surgeon. A cardiologist specializes in disease of the heart, circulation, or cardiology. A pediatrician is specializes in the disease or elderly patients or geriatrics. An anesthesiology specializing in anesthetics. Choosing a specialty. Jill Matthew has just graduated from medical school and is talking about her future. I haven't decided what to specialize it in yet. I need more experience before I decide, but I'm quite attracted to the idea to pediatrics because I like working with children. I will certainly prefer to work with children than say elder patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialized like neurosurgery don't really appear. You have to be good with your hands, which I don't think is a problem for me. I have been assisted at operations several times and I have even done some minor OPC by myself, but surgeons have to be able to do the same things again and again without getting to do the same thing. Bore, like tying of cut arteries and so on. I don't think that will be a problem for me, but they need to make decisions fast and I'm not too good at that. I like to have time for things, which means surgery is probably not right for me. Note: the collocation good which is followed by a noun hers good with children. The collocation good at is followed by the ing form gerund of adverb of by a noun. She's good at explaining procedures. She's good at explanations. Okay, Let's continue with the exercise of this unit. Okay. 1. Which sentence to describe the work of the specialist in each brand of medicine? Look at B opposite to help you. 1. Dermatology. A dermatology specializes in disease of the skin. 2. Rheumatology. A rheumatology specializes in disease of the skin. 3. Traumatology. A traumatology specializes in the treatment of injuries and injuries. Yeah. 4. Pediatrics. A pediatrician specializes in the medical care of children. And 5. Obstetrics. An obstetrics specializes in pregnancy and childbirth. Number 2. Complete the table with words from A, B, and C opposite and related form. Put a street mark in front of the stressed syllable in each word. The first one has been done for you. Okay, specialize, specialist, and specialization. Practice, practitioner, and practice. Consult, consultant, and consultation. Assist, assistant, assistancy. Graduate, graduated, and graduation. Qualified, and qualification. Number 3. Find preposition instead opposite that can be used to make word combination with the words in the box. They use the correct form of the words to complete the sentence. Good, interested, specialized, and work. 1. A pathology specializes in diagnostic disease through examining cells and tissue. 2. A pediatrician must enjoy working with children. 3. Oncology specializes in the diagnostic and treatment of cancer. 4. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. 4. Make word combination using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. Consulting rooms, general practice, grow practice, health center, internal medicine, surgical specializes, and general practitioner. This is the first video. Thank you so much. Let's continue with the next one. Okay, teacher, let's continue with the unit 6 that called medical practitioners 2. That is the unit 6. Okay. A. Hospital staff. The people who work in any type or workplace, including hospital, are called the staff. The medical staff in a British hospital belong to the one of 4 main groups. A pre-registered house officer, PRHEO, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner in the current system of training. The foundation program, the name for these junior doctors is Foundation Year 1 Doctors, or FG1. A senior house office, or CHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctors, or FG2, but the all team seniors house office and HO are still used. A specialized register, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars. doctors who have completed the training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associated specialist senior doctors who do not wish to become consultants. In addition, there is at least one of medical or clinical directors who is responsible for all of the medical staff. B. Medical team. Consultants, physicians, and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are a multidisciplinary team which consists not only of doctors but also of physiotherapists and the others allied health professionals. When patients enter or are admitted to the hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive a treatment and care. The junior doctors clerks then takes their medical history and examines them. Sometimes later, the register also see the patients and may order investigation or tests, for example, X-rays or an ACG, make a provisional diagnosis and begin treatment. The consultants usually sees the new admission, people who have recently been admitted to the ward for the first time on one of the regular one round. When the management of the patient is discussed, which the registered consultant also decide when a patient is really to be discharged, sent home on the ward around. The consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's cares. Number C, shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 to 3 p.m. and are then free until 7 a.m. The next day, after the week, they change a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return to the hospital if necessary, from 5 p.m. to 9 a.m. The next day, days on call are set out in a rota or list of a name. A time doctors on call carry a radio page, a bleeper, a device which make a noise when someone is trying to contact them. Okay, let's continue with the exercise right now. Okay, perfect. The first one is make word combination using a word from each box. Look at B and C. Opposite to help you. Associated specialist, house officer, on call, provisional diagnosis, and radio pager, and word round. The number two is match the description 1 to 5 with the job title. A to A, yeah, look at the word, and A and B, opposite to help you. Number one, the Dr. Grant has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60 consultants. Number two, the Dr. Stewards had just started the second year of the foundation programmer, ACE HO. Number three, the doctor since has started his training as a surgeon, specialized register. Number four, Dr. Phillips has just graduated and is working in a large hospitals of Birmingham, PRHO or house officer. And five, Dr. Miller is it is in charge of the medical staff in Birmingham Hospital, medical director. Okay, let's go with the number three. That is, are the following statements true or false? Find C reasons for your answers in A, B, and C are positive. Number one, a medical graduate become registered 2 years after graduation. That is false. The assistant or training doctors in British is called the foundation programmer. That is true. Number three, the name seniors house officers is no longer used in British. That is true. Four, the consultants is usually the first doctors to see new patients. That is false. Five, when working in shift, all doctors take turns to be on call. True. Let's go with the number four. That is, complete the test of Pierre HO describing her job. Look at A, B, and Z come opposite to help you. When I get to the war, the first things I do is talk to the house officers who was on duty during the last shift to find out if there have been any new admission. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or a take down. Later in the morning, I admit any new patients, which is basically involves talking a history on Thursday and Friday morning. The consultants does her work around, and I have to make sure I'm completely up to the day of the patient. After that, there are usually lots of things to do, like reading or rescue from foreign for blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home, and then of course there are the lectures and tutorials in the foundation programmer on Monday and Wednesday. Okay, this is all. Let's continue in the next video. That is the number three. Okay, teacher, thank you so much. This is the video number 7, the unit number 7, that called nurse. Let's start it. Okay, nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training, a staff nurse, as a nurse who has completed the training courses, charge nurse, a more experienced nurse who is charge of or responsible for a ward or department, a nurse management, a nurse who is charge of several wards. No, the old term sister is still something used for a female charge nurse. A female nurse might be called matron. B. Support workers. The clinical support workers who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified but assist nursing staff. There many also be ward clerks who do duties including making sure patients know our information are up to date and answering the telephone. C. Specialization. Like doctors, nurse can specializes. A midwife has specializes from the beginnings by doing a course in midwifery, the management of pregnancy and childbirth, District nurse visit patients in their home and health visioners. Also works in the community giving advice of the promotion of health and prevention of illness. The nurse roles. The nurse role has changed considerably in the recent year. In addition to general patient care, checking temperatures, pulse rate, and blood pressure, changing the dressing and giving injections, and removing sutures. Nurses now do some of the things previously reserved for doctors, such as prescribe drugs and ordering laboratory tests. More responsibility for nurse is planned as the following article demonstrated. Nurse carry on surgery is in effort order to cut patients waiting list. Nurse is a Scotland trained to perform a minor surgery have entered to the operation treated for the first time in an effort to cut patient waiting time. Five nurses who have passed a new course at Glasgow Caledonian University are not qualified to carry out such procedures as the removal of small lesions, begin mold and cysts. The verbs perform and carry out are used with all type of procedure. They are often used in the passive form. For example, perform, carry out an examination, an operation, a procedure, a experiment, a test, or a biopsy. The procedure was performed and carried out by a nurse. Okay, let's continue with the exercise. Okay, let's do it. The first one, complete the sentence, look at A and B and see opposite to help you. Number one, someone who specializes in delivering babies is a midwife. Two, someone who is qualified to assist nurse is a clinical support worker. Three, someone who is not qualified but is able to assist nurse is a nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who specializes in health promotion is a health visitor. 6. A nurse who looks after the wall is a church nurse. 7. A nurse who works in the community is a district nurse. And 8. Someone who answers the ward telephone is a ward clerk. Number 2. Make word combination using a word or part from each box. Look at the opposite to help you. Carry out procedure, change the pressing, check the temperature, give an infections, and remove sutures. Complete the sentence with the correct grammatical form of perform. An isotope brain scan is painless and easy to perform. 2. Biopsy of the pancreas was performed last March. 3. In the patient condition deteriorate, a laparotomy should be performed. 4. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. And 5. Last year we performed a randomized double-blind group study. Number 4. Complete the sentence with the correct grammatical form on carry out. I now intend to carry out a large study. 2. Unfortunately, few properly controlled trials have been carried out for so far. 3. A number of studies have been carried out recently to look at this question. 4. A right emilescotomic was carried out and the patient made a full recovery. 5. This procedure can be carried out in the emergency department. That is all, teacher. Thank you so much. And let's continue with the unit 8. Yeah, 8.